I had been on birth control pills ever since I was a little girl because I had really irregular periods and I had horrible, horrible acne to the point where I had to see multiple dermatologists and take all these medications that didn't work, and I had to use Accutane to make it go away. It was very, very severe. And so when I stopped my birth control pills as a fourth-year resident, I didn't have any menstrual cycles. And so it seems kind of silly that I'm saying this out loud right now, being a fourth-year OB-GYN resident, but I realized at that point that I had polycystic ovarian syndrome. And so I was actually amenorrheic, which is the medical term meaning I did not menstruate at all on my own, which means I wasn't ovulating. This is a different experience, going through it. Ironic, right? Because here I am, a resident trying to go through my fellowship. So I'm learning about it and I'm going through it at the same time, which really helps you learn about it. So I was actually about to head to my fellowship. I had an oral presentation to give, and I remembered I was like crying right before I left because I was like, I just want an IUI, and I never got to that point. And so after that, I realized I needed to do IVF for in vitro fertilization because the more conservative treatment was not helping me ovulate. So then I went here at Care Fertility, and I went through in vitro fertilization. I now have 4 kids. My first 3 are from IVF. So my oldest is from a fresh transfer here at Care Fertility. And then I miscarried from a frozen after that. It was about 13 and a half weeks. And then I had 2 other children from a frozen cycle. So I have probably could fill a bathtub full with all of the needles I've injected myself with all the fertility treatment. I do it 1,000 times over again to build my family. It was definitely worth it. So I'm very thankful for our field because I wouldn't have my family without it. I feel like I'm glad that happened to me because I'm a much better physician now going through the fertility treatment that I have and experiencing a miscarriage. I feel like I have a lot more empathy for my patients because I truly have, no 2 people going through infertility have the exact same story, but I feel like I've been through a similar journey.